look at it, yes?
Yeah, oh, you can do. You can just talk to me. So Dr. Brogan, can you share with us how you first became involved with this ENT medical collaboration for children with nasal breathing problems?
Well, I think it basically arose from the fact that I was involved in the cleft lip and palate unit and working with cleft lip and palate surgeons, plastic surgeons, and of course the ENT surgeons. And we were cooperating across a wide range of fields. I was aware of crossbite causing mouth breathing, and if you could expand the crossbite into a normal occlusion, you did get an improvement in nasal breathing. And then Lindsay Gray, who was the ENT surgeon, started talking to me about deviated septum and what we could do about it in cooperation. And initially we were going into the neonatal unit at King Edward Maternity Hospital and seeing newborn children, the ones who've been born during the last week. We'd go in on a Sunday morning and he was examining them, and you'd usually find 2 or 3 with a significant deviation of the septum, and he would straighten that up with a pair of forceps. I would take an impression of the palate, and then we would follow up 2 to 3 years later, take another impressions to see if there was crossbite, and also check the septum, the nasal breathing, etc. That was the beginning, and then I became aware of quite a lot of children, seeing in Princess Margaret at first, with crossbite and sleep apnea, difficulty in breathing, asthma, the whole range of nasal problems, and developed a system with silver splints cemented onto the teeth with an expansion screw between them, and the patient's parent would give the expansion screw 1 turn every night, and it usually took about 6 weeks to get the amount of expansion I felt was needed. Once the appliance was removed, it was important to get a removable plate in as a retainer immediately, and that would be worn full-time for 6 months and then for another 18 months. Long-term retention, I found, was essential to a good long-term result, and at least 2 years is needed for the bone to restructure in the midline.
And one of the studies that you published was 310 consecutive patients, and you ultimately went on to do much more cases, and often by referral by medical colleagues as well. Can you share what it was regarding their nasal breathing and other medical issues that you noticed improved?
Well, mainly it was the things the patients were most conscious of usually were snoring, mouth breathing, and colds, more colds and tonsillitis and that type of thing than the average child. And sometimes also sleep apnea, difficulty sleeping, etc. And nasal constriction, the whole gamut of blocked nose problems, if you like. Asthma, of course, to a lesser degree, because that's a very multifactorial problem. But we did find in doing rapid expansion, about 33% of the patients with asthma got a significant improvement in their asthmatic situation. The key to the treatment, as far as I was concerned, was to do it as early as possible. And again, this was something I was comfortable with, which the average dentist probably isn't, because I was used to treating children from 12 hours old onwards, and right through kindergarten and preschool and so on, whereas the average dentist was not comfortable treating small children. And I found that the best time to get a really good long-term result was starting in the age group 4 years old onwards, up to about 9 or 10. This gave you your best results. It's still possible to do rapid expansion on older children, and you get quite good results. It's possible to do it on adults and get results. I think the oldest case I treated was 30 years old. But the older the child gets, once you get into the 12, 13 plus, you're getting a more painful situation, although very often the cooperation can be better, because if you're treating them at that age, it's usually the ones who've got really major problems, ENT problems, long-term situation, and they are very grateful for anything that will give them improvement.
And I think what's really important to do it at that very young age is when our best need for restorative sleep is as well. It can really impact a child's daytime function. So your study was actually one of the first studies that showed that improving nasal breathing could actually improve their daytime function. Can you recall what some of those parents would tell you about their child during the day?
I think the main thing was children were sleeping much better, which of course does have a significant impact on their daytime activities. They were breathing much more freely, and this certainly improved their athletic abilities. And of course they weren't getting the as many colds, or they weren't drooling as much, which was another problem. It was a wide range. If you improve a child's health, you're going to improve a child's performance, basically.
Yeah, attention, concentration, and all those things were mentioned in the study as well. And so really you were very instrumental in integrating care here in Perth, which has not really furthered too much, but for people elsewhere around the world, what do you want them to take home from this work that you've been done?
Well, I think from the dental side, dentists don't normally look at noses a great deal, but if they listen to their patients, if they look at a patient with crossbite and they ask about nasal function, then I think they'll discover, if they correct the crossbite by rapid expansion, not just by alveolar correction, then they will get a significant improvement in nasal breathing and so on and so forth, nasal symptoms. But you've got to look for it. From the medical side, I think the ENT surgeon should be aware, if he's seeing a child with a deviated septum, with poor nasal breathing, mouth breathers. I think both dentists and ENT surgeons, mouth breathing is the most obvious symptom, and it's the main thing that it's useful to correct, actually. If you can get them onto permanent nasal breathing, they have normal function. And that should be fairly obvious to both medical and dental people. Fantastic.
Your work has been so influential around the world on Dr. Christian Gimeno, who we are all inspired by. So thank you very much for spending the morning with me. Thank you.